Oh, that was funny. Yeah.
Okay.
Hi, welcome. We are Suzanne Lynn and Dr. Chuck at Lifetime Dental and Your Filthy Mouth. And we're live because, well, we got a lot of fun things going on. And
Yeah.
I have to just start by saying, I told Dr. Chuck, I'm so sorry. I didn't bring any mints. And what did you pull? He goes, oh, here. Okay, so you know the disaster that would have been
We'll
there.
talk about this in a little bit. If you don't know what these are, you will.
It's kind of like eating Oreos before you go to the dentist. Okay, I'll just give you that. So Dr. Chuck, we were very excited because last week he was one of just 12 chosen to do the TEDx talk in Eustis.
Yeah,
And of course, your message is what happens in your mouth is affecting the rest of your body.
absolutely. Yeah. What happens in Vegas may stay in Vegas, but what happens in your mouth goes everywhere in your body.
What kind of response did you get?
I got a great response.
Yeah.
And in fact, it was interesting. I got a text from my daughter this morning who was talking, and she works at the hospital, and they're talking about it in the hospital because we need to start connecting the dots between the mouth, the rest of the body, between physicians and dentists. We need to start closing this deadly gap. And this is just one step in that direction.
And, I'm not trying to be negative. I want to keep everything positive all the time, but we've tried, efforts have been made by dentists to try to talk to physicians and ask them to please make this part of a routine checkup and everything. So now you're going to the public and you're saying, look, you go to your doctor and say, could some of my symptoms, could some of these problems be mouth related? You're empowering the people to do this.
Well, knowledge is power. Well, knowledge is potential power, like Napoleon Hill said. It only becomes power when we put it to work. And so you can know something, but if you don't do anything about it, nothing's going to happen.
Right. So we are so honored to give you an encore presentation of the TEDx talk from Eustis. And I'm going to turn this over to Dr. Chuck. We're so excited. Thank you for doing this.
Okay.
Get out of the way here.
Well, we'll see how it goes here. Yeah. Good. Whoa, there you go. Is your dental health affecting your medical health? Chances are the answer is yes, and you don't even know it. Nothing hurts. Here's Debbie's story. Debbie had a pimple on her thigh. It grew into an abscess, and it had a lot of pain, so she went to see the doctor. After she went to the doctor put her on antibiotics. The abscess went away, and then it came back. So about 3 weeks later, she went to the doctor again, put her on antibiotics a second time. The abscess went away, and then it came back. Third time, the doctors decided, we're going to culture this and find out exactly what we're dealing with. Well, when they got the results back from the lab, come to find out they're dealing with oral bacteria. They were coming from Debbie's mouth. She didn't have a toothache. So the doctors recommended, well, she hadn't seen a dentist for years because she didn't have a toothache. No reason to go see a dentist. So her physician said, you need to get a dental exam. When I examined Debbie, I found 3 abscessed teeth, 3 of them, and absolutely no pain. Debbie was shocked, and so were her physicians. Her physicians never even considered her mouth because she didn't have any pain. Turns out her mouth had a bigger effect on her medical health than her doctors ever thought. Here's another story. My son has been listening to me talk about the oral systemic connection for years. He met a fellow at work who was talking about the heart attack he had a year earlier. This guy was 34 years old. They did open heart surgery on him, cut him open. The doctors determined the cause of his heart attack was a tooth infection, a dental abscess with absolutely no pain. Well, now this guy's got a big scar going down his cheek, but today he's taking really good care of his teeth. My son is an even bigger believer right now. So there are over 630,000 deaths a year in the United States from heart attacks. That's huge. Some researchers believe that 50% of these heart attacks are triggered by dental infections, oral infections. That's over 300,000 deaths in the United States every year caused by preventable dental infections. We got to pay attention. The United States Surgeon General back in the year 2000 wrote a big report that basically says you need a healthy mouth to have a healthy body. Just because something doesn't hurt doesn't mean it's okay. Did you know that 90% of dental infections have absolutely no pain? Nothing. Gum disease doesn't hurt. Most tooth infections don't either. People are really surprised to find out that dental infections don't have to hurt, but yet we readily accept the fact that high blood pressure doesn't hurt, diabetes doesn't hurt, glaucoma, cancer, they don't hurt. Just because something doesn't hurt Doesn't mean it's okay. Doesn't mean it's healthy. If you don't have a toothache, if you don't have any dental pain, how do you know you have a dental infection or not? You see a good dentist for a good dental exam. That's how. Have you ever put off going to the dentist because nothing hurt? You're not alone. The number one reason people don't see a dentist isn't pain or expense. It's lack of pain. Nothing hurts. I'm fine. I don't need to see the dentist. That's why I like pain. I like pain. I'm a dentist. It's a great motivator. It's a great motivator. Now, no matter where you're sitting, if you're over 30 years old, would you raise your hand wherever you are? 30, there you go. Got your hands up too. You put your hands down. According to the Center for Disease Control, 47% of Americans over the age of 30 have gum disease. Gum disease. And if you're over 65, that jumps to over 70% who have gum disease. Gum disease is an infection in the gums dumping harmful bacteria right into the bloodstream. And there's no pain, no indication you have it, other than your gums may bleed a little bit when you brush your floss. Now, all infections, including gum disease, produce pus. What's pus? That yucky white stuff, right? Yuck. Well, what's it made of? It's made of harmful bacteria, dead tissue debris, dead white blood cells, inflammatory proteins, and some other toxins. Well, where does the pus go? Well, it either drains out or it drains in. If it drains out, you see it, you clean that wound, get the pus off, clean it up. Every time you pop a pimple, that's pus. If it drains in, you never see it. Well, where does it go? It's absorbed into your bloodstream. Well, from there, where does it go? Well, it works its way to the heart, to the lungs, back to the heart, and then it's pumped through the whole body. If you think pus being pumped through your arteries 24 hours a day, 7 days a week, for weeks, months, and even years is healthy, think again. The bacteria in gum disease have already been proven to cause cardiovascular disease. That's huge. This is as big as when they said tobacco was bad for you. I mean, that's how big this is. Cardiovascular disease triggers heart attacks and strokes. Heart attacks are the number one killer in the United States. Strokes are the leading cause of disability. Gum disease and diabetes have a bidirectional relationship. That means when your gum disease is bad, your diabetes is bad. When your gum disease improves, so does your diabetes. Researchers are finding oral bacteria in the brains of Alzheimer's patients. Rheumatoid arthritis is directly affected by our body's inflammatory response to dental infections. Oral bacteria affect pregnancy complications, from preterm births to stillborns. Our teeth and gums are major players in our body's overall health. Think your dental health isn't affecting your medical health? Think again. Let's talk about medications. Melissa's a nurse. The only medication she was on was for high blood pressure. She went to the doctor, they took her blood pressure, it was high. They gave her some pills. Her blood pressure came down. Everything was okay, right? Well, when we did an exam on Melissa, we found an abscessed lower left molar. I'll never forget it. Big old abscess. No pain. It felt a little different, but didn't have any pain. We put her on antibiotics, and about 3 or 4 days later, we removed a hopeless tooth. She came back in 3 weeks and said, guess what? I don't need my blood pressure medication anymore. Can a dental infection raise your blood pressure? Absolutely. An infection anywhere in our body can raise our blood pressure. Our body is fighting the infection. We need to find and eliminate the source of the disease, not just treat the symptoms. Physicians were never trained to request a dental health report from their patient's dentist. Maybe a dental health report should be included with a complete physical exam. If we examine the mouth, we just might discover the source of some of the diseases our doctors are continuing to treat with numerous medications. It's worth an oral exam. Think your dental health isn't affecting your medical health? Think again. When the doctor tells you you've got an infection somewhere in your body, your heart, your lungs, your brain, anywhere in your body, one of our first questions should be is, where did the bacteria come from? Unless you've got open cuts, wounds, or sores on your body, there's a real good chance they're coming in right through our body's front door, our mouth. If we can keep our mouth really clean, we're helping to remove bacteria that have already been proven to cause or affect cardiovascular disease, heart attacks, strokes, diabetes, Alzheimer's disease, rheumatoid arthritis, pregnancy complications. And they're adding more to the list every year. Think your dental health isn't important? Think again. Now I'm going to give you 3 simple steps you can do to have a healthy mouth and help prevent from getting any of these horrible diseases. Step number 1, start at home. Begin thoroughly cleaning your teeth every day at home. Think you already are? Think again. I've been looking in your mouths for over 40 years, and I can guarantee you the vast majority of you are not doing near as good a job as what you think you are, really. It takes a lot more in time than it does money to thoroughly clean your teeth. It takes 5 to 10 minutes to thoroughly clean your teeth. You can't do a good job in 2 or 3 minutes. The average person spends 30 seconds or less. We have to be better. Thoroughly cleaning our teeth 1 time a day is much better than doing an incomplete, mediocre job several times a day. Thoroughly cleaning our teeth is a lot harder than you think. Now, I'm not about to tell you the best way for you to clean your teeth because I don't know what's going to work best for you. Personally, I'm not hung up on technique. I'm hung up on results. The object is to get the bacteria off your teeth without damaging the tooth or the gums. That's it. There are a lot of right ways. There are a lot of wrong ways. I like an electric toothbrush, but you can use a manual. It just takes a lot longer. I like directed water irrigation, but you can use dental floss or those little brushes that go in between your teeth. Bacteria love to hide where the toothbrush can't reach. Go to the store, go online, look at all the different dental cleaning products that are available to you. Find out what works best for you and use it. Because step 2 is to grade yourself. If you take a test and it's never graded, how do you know how well you did? You don't. Plaque is the same color as your teeth. How do you know you got it off? Here's how you can check. This is called disclosing solution, and these are disclosing tablets. They work the same way. A lot of you know what they are. Some of you don't. They stain the bacteria on your teeth. They're available over the counter or online, and they're really inexpensive. Now, don't use these before you're heading out the door to go somewhere, because it can give you bright red lips and a purple tongue. But here's how you use it. Clean your teeth as thoroughly as you can to where in your mind you've done a great job. Then chew up one of these tablets or paint the solution on your teeth. Get your tongue to move it all the way around there. Rinse your mouth out with some water. Now go to the bathroom mirror and look inside. Take a look and pull your cheek back. Use a flashlight if you need to. Wherever there is stain on your teeth is where you still have bacteria. Doesn't mean you didn't brush there. It means you didn't get the bacteria off. Now go back and clean off the stain. This is when you begin to learn that it's not as easy to clean your teeth as you really think. That's why it takes 5 to 10 minutes. If we can teach our kids how to thoroughly clean their teeth, we're going to save a lot of money on dental expenses. Plus, we just might have some healthier kids. Wouldn't that be nice? Now, our job is to be the example. That means we have to spend 5 to 10 minutes ourselves thoroughly cleaning our teeth. Our kids learn a lot more by what we do than what we say. Now, step 3 is to see a good dentist for a good dental exam and do whatever it takes to have a healthy mouth. When I look on the highway, not everybody's driving a Cadillac, but everybody needs transportation. You don't need a Hollywood smile to have a healthy mouth, but you need a healthy mouth to have a healthy heart, a healthy rest of your body. When you look on the highway, again, not everybody's driving, sorry about that. There are many options that you have for taking care of your teeth. Find out what they are and do them. Taking care of your teeth is not selfish, it's smart. You can have a healthy mouth for a lot less than it costs to go to the hospital for 1 to 2 days. Not to mention the cost of time missed from work or from school, plus the emotional pain to the whole family. Now, you may have to make a financial investment in your dental health. That's okay, but only if you're willing to spend that 5 to 10 minutes every day thoroughly cleaning your teeth. Otherwise, you're just throwing your money away. Dental care is not expensive. Dental neglect is very expensive in more ways than one. Think your dental health doesn't matter? Think again. is absolutely necessary for complete medical health. Debbie had pain, drive her to go see the doctor. Melissa came in without any pain. Both of them had dental issues causing medical issues. Neither of them knew it. How about you? Do you have a dental issue causing a medical issue and don't even know it? If you raised your hand earlier, there's a really good chance you just might. We need to begin connecting the dots between our mouth and the rest of our body. The Surgeon General was right. We need a healthy mouth to have a healthy body. If this information makes sense to you, I'm going to ask you to share it with your physicians, your family, and your friends, no matter where they live. Dental health affects the medical health of everybody. So you didn't think your dental health was this important, did you? Think again. Thank you.
Dr. Chuck, that was amazing. Awesome, awesome, awesome. Got a question? From Karen. She said, I hate to say it. I was a cardiac nurse, and Dr. Chuck is right. We had a lot of patients admitted because they never went to the dentist. I will be the first one to say I hate going to the dentist. Karen, way to go. That's awesome. Thank you so much. And I know for a fact Karen's checking in from the area, and we're just so thankful because we want to share this, not just here, but all over. And Dr. Chuck, there's so many things that I took away from what you talked about, but I'm just going to implore you, if you have any reason to think that maybe something that's going on medically could be starting with your mouth, please listen to Dr. Chuck. Go to yourfilthymouth.com. You want to talk about that a little bit? Yeah,
we have a website called yourfilthymouth.com, and the whole idea is to give you the information. We're not selling anything on there. The whole idea is for you to see we're not making this stuff up. Mm-hmm. We've got links that go to the research that shows how your oral health affects your cardiovascular health, your diabetes, your pregnancy complex. There's links that goes to the research on this. I'm not the expert. I'm a regular dentist. But we're connecting the dots, and we want you to understand that it's so much more than just a smile and chewing your teeth. Mm. A lot of people think that your teeth are for smiling, chewing, and talking. But there's three other things. There's number one is the infections from either the teeth or the gums. That's what we're talking about, getting in there. Number two is actually the airway. So a lot of people, that's a whole different subject. We can get into that, but airway is a big deal with the mouth. And the third is the bite, the way the teeth come together. If they're not coming together right, you can have headaches, neck aches, all kinds of other problems. So it's not just a smile. Right. It's so much more than that.
Yeah, and actually, when you go to yourfilthymouth.com, if you know someone who's pregnant or you've got someone with a bit of a mature mouth and they maybe have a hard time getting their mouth, we have so many amazing videos from Dr. Chuck. We just want you to go. We love you. We want to make sure that you're healthy. So anyway, I'm going to dig in here. One day, maybe I'll do this on one of our shows, but not today, Dr. Chuck.
You're a great man, so you ought to try it.
Thanks for joining us. Have a great day. And share this information, please.
Thank you.